Making the Psychiatric Appointment by Rhonda Palmer. Children and adolescents with mental health disorders are some of America's most vulnerable population. Statistics show that 50% nationwide children received mental health treatments. Further, 70% of incarcerated youth have a diagnosed mental health disorder. With those alarming statistics, it is questionable why states eliminated 4,500 psychiatric hospital beds, totaling 10% of the availability in America. This resulted in an inundation in the outpatient psychiatric mental health clinics, who often would see children who were severely mentally ill. Considering the seriousness of missed appointments, studies still show that 48% people miss their first appointment. And for follow-up appointments, 11 to 19% miss. What happens when a child or an adolescent does not make their appointment? School success is thwarted. There's makeup work. There's peer pressure where you're asked, why are you having to go to the nurse to get your medicines? Or why do you have to be taken out of class to see a therapist or a social worker? And then medication interruption equals decompensation, where it shows that studies say 30 to 60% of mentally ill children have hospital readmissions. Missed appointments reduce provider productivity and clinic efficiency, increasing healthcare costs up to $444 billion yearly. And then toxic stress from being mentally ill will affect a child's brain development, often setting them up for future adult psychopathology. And then most seriously, suicide as a contributor from depression is the second leading cause of death for youth. What has been done already? This year, an electronic phone prompt reminder call system was introduced, but it only had a 5% reduction in missed appointments, and it was a costly investment. Additional efforts were looked at medical providers, schools, and therapists. There was no constant theme here of why children missed appointments in this group. Also, appointment day and hour was looked at, but again, there was no constant data that showed why it was those days or hours. Often what you see is kids change schools. They come at different times of the day or different hours. And still, with even trying to figure out where the most missed appointments were and arranging different hours and days, different times, and schools and therapists, the missed appointment rate continued to hover at around 20%. Since other options looked at yielded only negligible results, looking at other reasons for missed appointments is justified. This Capstone project will look at, does diagnosis and medication determine who shows up for an appointment? Medications and diagnosis are the two constant variables that could be used to determine the probability that a client will not show up for an appointment. There are 11 categories in the ICD-10, and they are ranked by severity according to provider perceptions. Medications are classified according to the symptoms that they treat. Listed are antipsychotics, anxiolytics, antidepressants, antiepileptics, sleep aids, stimulants, and alpha-adrenergic drugs. Using Everett Rogers' theory of diffusion of innovation, which looks at system changes instead of behavioral changes with people, this Capstone project will focus on diagnosis and meds instead of individual behaviors as has already been done. This is a radically different approach to most other theories of change. The goal. Based on the results of what medications and what diagnosis do we see as missing most appointments, there will be a practice change. Perhaps by adding intensive services, like Rapid Round, for clients with those certain diagnoses and meds, which could help them facilitate making their appointment. Double booking clients based on their meds and diagnosis. Increasing company revenue by reducing missed appointments with a target goal of no more than 5% missed appointments. And then a final question, is there sufficient education for parents on their child's mental illness? Is there a difference between a child who has a psychotic disorder, missing an appointment, versus a child who has just a minor mental health diagnosis of ADHD? Recent studies showed childhood ADHD symptoms were less likely to be seen as serious, less likely to be identified as a mental illness, and less likely to be viewed as requiring treatment. For humane reasons alone, it is imperative to find out why those in need of help do not show up and what can be done to reach them. Thank you.